Could your headaches and missed periods be a tumor? Find out the shocking truth. What are the first signs of a brain tumor? Do you ever notice subtle changes in your body that just don't feel right? Perhaps irregular periods, unexpected fatigue, or worsening headaches. These seemingly small signs could be early clues that something more serious is happening, like a prolactinoma, a benign tumor in the pituitary gland. Prolactinomas lead to an excess of prolactin, disrupting hormones that regulate everything from your reproductive health to your mood. But here's the problem. Many people don't realize the connection between these symptoms and a prolactinoma, assuming it's just normal aging or stress. The earlier you recognize these signs, the better the chances of effective treatment and a return to good health. So, let's break down the key signs of prolactinoma and what you can do about them, because catching it early can truly make all the difference. So let's begin with sign number 1, because time, as always, is of the essence when it comes to your health.
Sign number 1, menstrual irregularities and fertility clues. One of the earliest signs of a prolactinoma is often missed, especially in women. It's something many women simply accept as normal changes due to age, stress, or hormonal shifts. Missed periods. But here's the thing. If you're in your reproductive years and suddenly stop menstruating for a period of time without being in menopause, it's time to pay attention. Prolactin is the hormone that helps with milk production, and when prolactin levels get too high, it interferes with the body's normal hormone balance. In women, this often leads to irregular or missed periods, and sometimes it can cause infertility. In many cases, a woman won't even think to mention that her periods have stopped. It's only when she starts feeling other symptoms like fatigue, weight gain, or mood swings that she starts seeking help. If this sounds familiar, I encourage you to reach out to your doctor and have your prolactin levels checked. Prolactinomas can cause prolactin levels to rise significantly, sometimes over 100 times the normal range. When prolactin levels get this high, it disrupts the pituitary gland's ability to produce the other hormones that regulate reproductive health, such as estrogen and progesterone. This can lead to irregular cycles or a complete halt in menstruation. Now, it's important to note that there are other conditions that can cause missed periods. Polycystic ovary syndrome, stress, excessive exercise, or a poor diet can also be culprits. However, if you have no obvious reasons for missed periods and other signs are starting to show up, a prolactinoma should be considered. In fact, women with prolactinomas often don't notice their missed periods until the tumor has caused a more noticeable effect on their body, perhaps in the form of other hormonal disruptions, such as weight gain or mood swings, that she starts seeking help. So if you've experienced irregular periods that you can't explain, it's worth getting checked out, not just for prolactinoma, but for other potential underlying causes. The earlier you identify the issue, the better the chances of reversing the effects.
Sign number 2, vision changes from tumor growth. As the tumor grows in size, it can begin to put pressure on surrounding structures in the brain. One of the most critical areas affected by this pressure is the optic chiasm, which is the area where the optic nerves cross. This part of the brain is responsible for transmitting visual signals from both eyes to the brain. When a prolactinoma becomes large enough to press on the optic chiasm, it can cause noticeable changes in vision, particularly in your peripheral vision. This means you may have trouble seeing objects or people from the sides of your visual field. This is often described as tunnel vision, where the central vision is still clear, but peripheral vision becomes blurry or obstructed. This is why regular eye exams are important, especially if you notice a change in your vision that you can't explain. Sometimes people assume their vision is simply deteriorating with age, but in the case of prolactinoma, it's not just about aging, it's about pressure on the optic nerves.
Sign number 3, gradual onset of severe headaches. Another common sign of prolactinoma that is often overlooked is headaches, especially those that are gradually getting worse over time. These are not just typical headaches that come and go, but rather persistent and worsening headaches that you might not have experienced before. If you've noticed that your headaches are becoming more frequent, more intense, or more debilitating, this is something to take seriously. Often, these headaches start as a dull ache, but they can grow into more severe, constant pain. They may also worsen with movement, bending over, or even when you lie down. While it's easy to dismiss headaches as stress-related or from things like dehydration or sleep problems, the progression of these headaches could point to something deeper, like a prolactinoma. In many cases, these headaches are the result of the tumor putting pressure on surrounding brain structures, including the pituitary gland and other nerve pathways. It's important to note that not every headache is linked to a tumor. However, if your headaches are getting progressively worse, it's a sign that there's something more going on, and you should get checked out.
Sign number 4, thyroid changes and hormonal imbalance. Thyroid problems are another potential sign of a prolactinoma. The thyroid gland, which regulates metabolism and energy levels, is controlled by the pituitary gland. Since prolactinomas affect the pituitary gland, they can also interfere with thyroid hormone production. One of the most common thyroid-related issues associated with prolactinomas is central hypothyroidism. This occurs when the pituitary is unable to properly signal the thyroid to produce adequate amounts of thyroid hormones, even though the thyroid itself is healthy. This results in low levels of thyroid hormone, which can cause fatigue, weight gain, constipation, and even a slow heart rate, bradycardia. If you experience any of these symptoms alongside other signs of hormonal imbalance, it's important to investigate further. Thyroid function tests will reveal whether there's an issue with the thyroid itself or if the problem lies with the pituitary gland's regulation of thyroid hormone production.
Sign number 5, fatigue and lack of energy. One of the most common, yet often overlooked symptoms of a prolactinoma is fatigue. This fatigue can feel different from the usual tiredness that comes with a busy lifestyle. It's not just about feeling sleepy after a long day. It's a deep, pervasive sense of exhaustion that doesn't seem to improve with sleep. If you found yourself waking up tired even after a full night's sleep, or feeling drained throughout the day, this could be an indication that something is wrong. The tumor's effects on hormone production, specifically prolactin, thyroid hormones, and testosterone, can all contribute to this overwhelming fatigue. This exhaustion might make even simple tasks feel insurmountable. Climbing stairs, walking around the block, or even engaging in social activities might leave you feeling wiped out and needing to rest for longer periods. It can feel as if your energy has been completely sapped. Fatigue from a prolactinoma is not just physical exhaustion, it can also be accompanied by mental fog. Concentration becomes harder, decision-making becomes sluggish, and you may find yourself becoming more forgetful than usual. If this resonates with you, it's important to understand that the causes of this fatigue may not just be from aging or a busy lifestyle. A tumor affecting your hormones could be at the root.
Sign number 6, weakness in the bones. Did you know that hormonal imbalances can affect the strength of your bones?
It's not just calcium deficiency or aging that leads to weaker bones. When prolactin levels are too high, they can disrupt the production of key hormones like estrogen, testosterone, and growth hormone, each of which plays a role in bone density and strength. As these hormones drop, the bones can lose their strength, leading to conditions like osteopenia or even osteoporosis. You might notice this manifesting in a variety of ways: frequent fractures, unexplained back pain, or even difficulty maintaining posture. These bone changes can also make you more vulnerable to falls and fractures that wouldn't normally happen. For example, a minor fall or bump that would usually cause no more than a bruise might result in a fractured bone if the bones are weakened. And this is especially concerning in older adults, where bone density already begins to naturally decline with age. If you've experienced unexplained fractures, particularly those that occur from low-impact activities, it could be time to look deeper into the hormonal causes like prolactin excess. Sign number 7. Changes in cortisol levels and blood pressure fluctuations. Cortisol is a hormone produced by the adrenal glands and plays a vital role in regulating stress, metabolism, and immune function. However, when a prolactinoma grows, it can also affect cortisol production. This disruption can lead to unusual fluctuations in blood pressure, often causing hypotension or low blood pressure. If you've noticed feeling dizzy when standing up quickly, or if you've had episodes where you felt lightheaded or faint, it could be a sign of low cortisol levels. Cortisol works in tandem with other hormones to maintain blood pressure. Without enough cortisol, your blood pressure may drop too low, leading to symptoms like dizziness, fainting, and overall weakness. This drop in blood pressure can also be exacerbated if you've been taking medications for high blood pressure. In some cases, a reduction in blood pressure can cause problems with daily activities, making it difficult to stand up quickly or even perform routine tasks. If these symptoms are familiar, it's worth investigating whether your cortisol levels are being disrupted by a prolactinoma. Sign number 8, mood changes and increased anxiety. Hormonal imbalances caused by a prolactinoma don't just affect your physical health, they can also take a toll on your mental health. One of the more settled signs of this condition is a shift in mood. Many people with prolactinomas experience heightened levels of anxiety, irritability, or depression. These mood swings are often a direct result of the hormonal changes taking place in the body, including shifts in testosterone, estrogen, and other key hormones. The increase in prolactin itself can contribute to feelings of sadness or frustration, often due to a drop in energy, libido, and overall vitality. This can be especially distressing if you're unaware of the underlying cause. You might find that you're not as motivated as you used to be, or you might feel more anxious or low than usual. These mental and emotional changes can be tricky to pinpoint, as they're often mistaken for regular stress or age-related changes. However, if you've been feeling unusually anxious, depressed, or irritable, along with other signs like fatigue, infertility, or changes in menstruation, it's worth considering whether a prolactinoma might be to blame. Sign number 9. Changes in libido and sexual health. Hormonal imbalances, especially those caused by prolactinoma, can have a significant impact on sexual health. This can be one of the most frustrating symptoms for both men and women, as it often goes unnoticed until it becomes more severe. Prolactin is a hormone that plays a key role in regulating sexual function, and when its levels are too high, it can lead to reduced libido, difficulty achieving orgasm, and even erectile dysfunction in men. In women, prolactin excess can cause vaginal dryness, discomfort during intercourse, and a significant reduction in sexual desire. These changes in sexual health may be dismissed as age-related or simply part of life's natural progression, but it's essential to understand that they could signal something more serious, such as a prolactinoma. For men, low testosterone levels resulting from excessive prolactin can cause not only a loss of libido, but also physical changes like gynecomastia, enlarged breast tissue. This can be distressing and cause feelings of embarrassment and frustration. It's important to recognize that these changes are often hormonal in nature and are treatable. The good news is that once a prolactinoma is diagnosed, medications can be prescribed to restore normal hormone levels, which can often reverse the changes in libido and sexual health. However, if left untreated, the effects can continue to worsen, potentially leading to long-term damage to sexual health and emotional well-being.
Sign number 10 is unexplained weight gain. Many people experiencing hormonal imbalances caused by a prolactinoma report unexplained weight gain. This occurs because of the disruption in hormonal regulation, particularly the imbalance between prolactin and other key hormones, such as cortisol, thyroid hormones, and insulin. When prolactin levels rise, they can interfere with metabolism, causing the body to hold on to excess fat. The weight gain may not necessarily be dramatic, but it can be noticeable over time, especially around the abdominal area. Some people may also notice that they're gaining weight despite having a normal diet and exercise routine. It's important to recognize that while weight gain can be caused by many factors, when it's accompanied by other symptoms like fatigue, changes in menstrual cycles, and low libido, it's worth investigating further. A prolactinoma can contribute to metabolic changes that make it harder for your body to process and burn fat. For those dealing with these symptoms, treatment to normalize prolactin levels can often help reverse the weight gain. However, the sooner you address the underlying cause, the easier it will be to regain control of your weight and metabolism. Sign number 11, nausea and digestive issues. Another symptom that may be linked to prolactinoma is digestive discomfort, particularly nausea. This symptom often occurs in conjunction with other hormonal changes, such as thyroid dysfunction or changes in cortisol levels. These hormones play a crucial role in regulating the digestive system, and when they're out of balance, it can lead to digestive disturbances. For instance, when prolactin levels are elevated, it can cause a decrease in gastric motility, leading to bloating, nausea, and even constipation. If you've noticed that your stomach is constantly upset, or you're experiencing digestive discomfort that doesn't seem to go away, it could be another clue that your prolactin levels need to be checked. It's easy to overlook these symptoms, especially if you've dealt with them for a while. However, persistent nausea or digestive issues can be a sign that your body is struggling to maintain balance. Addressing the underlying cause, such as a prolactinoma, can often alleviate these symptoms and restore normal digestive function. Sign number 13, sleep disturbances. Sleep problems, particularly difficulty falling asleep or staying asleep, are another common sign of prolactinoma. Prolactin plays a role in regulating the sleep-wake cycle, and when its levels are disrupted, it can interfere with your ability to get restful sleep. People with prolactinomas often report waking up frequently during the night or feeling unrested upon waking up in the morning. These sleep disturbances can be caused by a combination of factors, including hormonal imbalances, stress, and even the pressure the tumor places on nearby brain structures. Disrupted sleep can lead to further fatigue, making it a cycle that's hard to break. If sleep problems persist despite changes in your routine, such as improving sleep hygiene or reducing stress, it may be time to consider hormonal imbalances as a potential cause.
Treating a prolactinoma can often lead to significant improvements in sleep quality, helping you wake up feeling more refreshed and energized. Sign number 13. Increased sensitivity to cold. In some cases, a prolactinoma can cause changes in temperature sensitivity. Many patients with prolactinomas report feeling unusually cold, even in environments that others might find comfortable. This is typically due to the tumor's effect on thyroid function, as discussed earlier. The thyroid regulates body temperature, and when prolactin interferes with thyroid hormone production, it can cause a drop in body temperature regulation. If you're finding that you're more sensitive to cold than usual, or if your extremities, hands and feet, are often cold, this could be another clue that your prolactin levels are elevated and impacting your thyroid. This symptom is often overlooked because many people simply chalk it up to aging or poor circulation. However, if it's accompanied by other signs like fatigue, weight gain, and depression, it's worth investigating further to see if a prolactinoma is the root cause.
Sign number 14. Hair loss and thinning hair. For both men and women, changes in hair health can be a sign of hormonal imbalance, including high prolactin levels. Elevated prolactin can disrupt the production of other hormones that are vital for healthy hair growth, such as estrogen and testosterone. This can lead to thinning hair or even hair loss. In women, this may be more noticeable as a change in hair texture or volume, while men may notice thinning hair or the development of a receding hairline. Hair loss caused by hormonal imbalance can be distressing, but it's important to know that it's often reversible once the underlying cause is treated. If you've been experiencing unusual hair thinning or shedding, especially if it's combined with other signs like irregular periods or low libido, it could be a sign that a prolactinoma is affecting your hormones. Treating the tumor can often restore hormone balance, which in turn can help promote hair regrowth and restore a healthy appearance. What can be done? The role of treatment in managing prolactinoma. By now, you should have a better understanding of the common signs and symptoms of prolactinomas. While this tumor is usually benign, the impact it can have on your health, if left untreated, can be significant. Fortunately, prolactinomas are highly treatable, especially when caught early. The first-line treatment for prolactinomas is usually medication. Drugs called dopamine agonists like cabergoline or bromocriptine can reduce prolactin levels and shrink the tumor in many cases. These medications are effective, with most patients experiencing a significant improvement in symptoms, including the restoration of menstrual cycles, improved energy levels, and better sexual health. In rare cases, if medication doesn't work or the tumor is too large, surgery may be necessary. However, this is typically reserved for cases where medication alone cannot reduce the tumor size or relieve symptoms. Conclusion: don't ignore the early signs. When you begin noticing small but significant changes in your body, like irregular periods, ongoing fatigue, or worsening headaches, don't assume these are just part of aging. These could be early warning signs that something more serious is at play. A prolactinoma, a benign tumor in the pituitary gland, could be causing these symptoms. Prolactinomas disrupt hormone balance, leading to symptoms such as missed periods, infertility, changes in vision, bone weakness, and even changes in mood. Although prolactinomas are generally non-cancerous, they can still cause serious complications if left untreated. The good news is that early detection can make all the difference. In most cases, medication can effectively shrink the tumor and normalize hormone levels, leading to a significant improvement in symptoms, often without the need for surgery. It's crucial to act early. If you're experiencing any of the symptoms we've discussed, irregular periods, changes in libido, fatigue, or vision issues, it's time to talk to your doctor. A simple blood test and imaging can confirm if prolactinoma is the cause and help you get the treatment you need before the tumor causes permanent damage.
Don't wait until your symptoms worsen. Early diagnosis and treatment are key to managing prolactinoma and preventing long-term complications. Remember, it's always better to seek medical advice sooner rather than later. If you found this video helpful, please make sure to hit that like button and subscribe to our channel for more valuable health insights. By subscribing, you'll stay up to date on crucial health information that can make a real difference in your life. Don't forget to click the bell icon to receive notifications whenever we upload new videos. Stay healthy, stay informed, and take action now for a better tomorrow.